I'm Mr. Ananda Gupta, consultant in ophthalmology, and I have special interest in macular diseases and medical retina. So I'm more or less based out of Fairview, where we are today, and I also have a specialist interest in oculoplastic surgery. It's an amazingly complex and a very nice multidisciplinary team consisting of doctors. We have consultants, we have senior house officers, we have fellows, we have registrars, and therefore there is a medical body available all the time. Along with them, we have nurse injectors, we have nurse practitioners, we have sisters, we have optometrists, and we have normal nurses. And we have a very dedicated photographic and imaging team, without whose help the unit will just not run. So it's a very well-oiled machine, and about 60-70 people work at the same time. We see about over 25,000 patients a year, if not more. And the bulk of the eye treatment happens out of the macular service here. I would say that the concept of care opinion is a very good one, because you have got to take it up. If the patients are not asked for a feedback, they'll only feedback when there is something not going right, and which of course some adversely affects them. But if you make them aware that this tool is available for them to write in, we are delighted as to, in fact flooded with the number of feedbacks we have. Quite a few of them do say about the weight, but that is for the management and for all of us to draw a lesson as to what exactly happened on that particular day. But I think as a consultant singularly named in these feedbacks, I'm very lucky and very fortunate that I've been able to make a difference to the lives and the sight of these patients. Probably I'm the only one who's been named singularly in the care opinion pathways. That shows quite a few things. Number one, the patient is very aware of who's treating them. Number two, the patient always will tell you the truth and will write what's happened, and will make their feelings obvious. And number three, they've got to be given a chance to do it, because 95% of patients wish to write back and have a feedback. I must say that we are sitting on a gold mine of stories, and there's just not one story to share. So if I read out one to you, the patient writes, "I was fortunate to get a cancellation on a Saturday morning." These are the initiative clinics we do, or initiative work we do, where we carry out the treatment out of normal hours. For an appointment at the Macular Clinic, I was very, very nervous, and I wanted to convey how impressed I was with the empathy and compassion I was shown by all the staff in the service. They all put me at ease. Everyone I met was so kind and caring. They were absolutely fantastic. I couldn't imagine having anyone better to provide my eye care than these people. You see, it goes a long way to say this. The care was under Mr. Gupta. It was great, and the nursing staff was fabulous. They clearly explained what was going on. And then she goes to the injection procedure, and we get at least 100 so far. Other one wrote that the service, the care, and the attention I received from Dr. Gupta is second to none. He's top class in his field, professional and friendly. He will always take time to explain my eye condition in a way I can understand. Thank you, Mr. G, for your care to me. So, me being on the other side, I often don't realize that these are the things that the patients are looking for, that makes up good medical practice. So, reading through this, I'm very happy that care opinion had made this happen. And I think this particular month is a care opinion awareness month. I think we should all encourage care opinion in whatever capacity we are to write back and feedback. The negative side is that sometimes they might write a negative comment, but there is so much to even learn from it. They will only tell you something which is constructive. They will not go out of their way to write something which is, unpleasant, but something which could be put to right and put right.